Hi, my name is Olivia Gonzalez, and I'm a PGY3 at the Comanche County Memorial Hospital Family Medicine Residency out in Lawton, Oklahoma. Our clinic has a high volume of pediatric patients, especially those less than 1 year old, and we also have a high population of breastfeeding mothers. So I chose to focus my QY project on vitamin D screening and supplementation for children from newborn to 2 months old. Vitamin D is a necessary component for healthy growth and development, and breast milk just does not contain the recommended daily amount. So both the AAP and the AAFP recommend vitamin D supplementation for breastfeeding newborns until at least 6 months of age. Prior to the project, we found a lot of our newborns hadn't been screened and therefore weren't being supplemented. So we initiated the project as a way to ensure that we were following with guidelines and to educate our parents. Our goal was to have 50% of the newborns that were seen and screened at the newborn well child visit to still be receiving vitamin D supplementation at their 2 month well child check. So we first created two templates, one for newborns and one for the 2 month well child check. The templates had a vitamin deficiency code of Z13.21. We also created gift bags that were for newborns that we were able to give out to parents at these newborn visits. So the bags had vitamin D drop samples in them as a way to ensure that they would be able to supplement. If at the newborn visit, the parent was breastfeeding their child, the Z code was left in. And then at the 2 month well child check, if the child was no longer being supplemented for whatever reason, whether due to switching to formula or just not parent non-compliance, the Z code of the vitamin deficiency was removed. We then tracked our Z code to see what our compliance rate was. The project took place from October 31st of 2024 to April 10th of 2025. By that point, 81 children were seen for newborn well child checks. Of those seen, 46 had the diagnosis code of vitamin deficiency, indicating the need for supplement. As of April 10th, only 9 child maintained that diagnosis code, indicating that one, they still needed to be supplemented, and two, they were continuing to be supplemented with vitamin D. Of note was 47 of the original 81 children had missed their 2 month well child check, and 25 are due for their 2 month well child check in the upcoming months. Based off of this, it would look like we had a 100% compliance rate as the 9 children who had needed a 2 month well child check and were seen were still being supplemented. But we then went further into the data and found that there were some discrepancies. So one child who was seen for a 2 month well child check and was taking vitamin D supplements did not have a Z code of vitamin deficiency logged at their newborn appointment. One who was being supplemented at the 2 month well child check hadn't been seen in our office for their newborn visit, and one who was seen at the newborn visit needed supplementation and was followed up at the 2 month. The mother did, and the physician documented that the mother was unable to breastfeed and they had switched to formula, but the Z code had been left in. So when we actually look at the raw data, it looks like there's a lot of discrepancies, so it's kind of hard to tell whether our results or our goal was met. This project can be improved upon in many ways. So when we first set out, we initiated the template and informed the residents at a didactics, but it seemed that there were some who were missing at that lecture. And so all of the residents weren't originally using the new template, and it took a while to get everybody on board. Also, we had to create the bags, and when we created the bags, we had an issue with a supplier. Initially, we were getting a steady stream of vitamin D drop supplies, but then around January, they stopped, so we started supplementing with like a coupon, which may have affected our compliance. Lastly, there's still a lot of children who are due for their 2 month well child checks, so we may have missed quite a few patients, but we hope to see that the numbers would rise. We're going to continue on with this project to see if that, as the time goes on, as we've moved out some of these barriers and some of the original discrepancies we have, if they can be removed, and then if we can increase our numbers overall to get a much better picture. So thank you all for your time, and we appreciate your day.